Okay, well, good morning or good afternoon, everyone. It gets me every time. Welcome to the Thursday, March 4th edition of the COVID media briefing for our community. And very pleased to have such a strong turnout today. And we look forward to hearing from many of our community partners as we share the current status of the COVID-19 pandemic in our community. Just a reminder to kindly please keep your mics muted until it's your turn to speak. Very pleased to have with us several of our elected officials joining us. I know some are hoping to make it depending on how question periods go. So when we get to the elected official component, I will more formally welcome them to this. So I would like to start us off on this sunny day with a quick, sorry, I'm just trying to do two things at once here, with a lovely land acknowledgement. I just want to thank my team for sharing this beautiful image with us. I think this is a place we all wish we were right now. Okay, with that, we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Michisagaig territory and in the traditional territory of the Michisagaig and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so with that, I will invite our board chair, Mayor Andy Mitchell, to start us off with some opening remarks. Please go ahead, Andy.
Yeah, thank you, Brittany. These past few days has seen a significant effort in vaccine rollout in the Peterborough area. All residents and staff of long-term care facilities will have received 2 doses by March the 9th, next Tuesday. Peterborough Public Health has now begun to vaccinate residents and staff at other senior congregate living facilities like retirement homes. Frontline healthcare workers, including paramedics, firefighters, and patient-facing medical personnel, are now being vaccinated. Rollout has begun in our local First Nations communities. During March, the vaccination program will expand, starting with the 7,000 area residents 80 and over who are living independently. It will be a significant challenge, one requiring maximum effort, but one I know our community is up for. I want to thank all those who are stepping up, the federal and provincial governments who are ensuring the acquisition and distribution of supply, local, municipal, and First Nations governments who are committing physical and human resources to the effort, to health professionals across the region who are coordinating medical resources to assist in the rollout, and to the residents of the city and county who have volunteered in large numbers, and to those residents who have been eligible recipients choosing to take the vaccines in significant numbers. As chair of Peterborough Public Health, I want to especially recognize Dr. Salvatierra and her team for their Herculean effort in coordinating the local vaccine rollout. After a year of maximum effort battling the pandemic, they are stretched and exhausted. But every day, frequently 7 days per week, they rise to the challenge and tend to the community's needs. Vaccines are an important tool, but it is also important to remember that as we go through the rollout this spring and summer, that public health guidelines must also be adhered to. Stay safe, be well, and in all things, be kind.
Thank you very much, Andy. Okay, so now we will get into the slides showing our statistics, and I'll invite Dr. Salvatierra to walk us through these. Please go ahead, Dr. Salvatierra.
Thank you, Brittany. So I'll begin with the situational update. As of 4:30 p.m. yesterday, there were 63 active cases in Peterborough, and our total count stands at 676 cases to date. That's 57 more cases than we reported last Thursday. So far this morning, we've already had 10 new cases that are now being investigated. And it is concerning to us that we are seeing more VOCs that are not related to our outbreak. The number of high-risk close contacts that we are following has certainly mushroomed from 156 last week to 241 as of last night. As far as our new cases reported by week, so far we are reporting 25 new cases this week. Last week there were 44 new cases reported. Much, but not all of this is related to the Severn Court outbreak. When we look at exposures, and this is one that we certainly watch very closely to understand how well we are containing the virus, you'll see that nearly 75% of our cases are linked to high-risk contacts. However, there are still at least 12 pending cases where we have yet to determine how they were exposed. Next slide shows our testing. Here in Peterborough, we have tested 43,750 unique individuals. That's 550 more than last Thursday. And when we look at our outbreaks, we are currently reporting 2 active outbreaks in our community. Some good news is that the outbreak at the Buckhorn Daycare and Nursery School was declared over. I understand that there will be some voluntary testing going on there this evening for those families and students and staff who are interested. The outbreak at Empress Gardens is stable, and the outbreak at Severn Court is still keeping us quite busy. We have 44 total cases and another 40 high-risk contacts that are at the Severn residence, with another 60 high-risk contacts that are located elsewhere in our community. 30 of these cases have now screened positive as a presumed VOC. For hospitalizations, we've had 25 hospitalized cases in total since the outbreak began. Most of the cases hospitalized currently at PRHC are transfers from other regions, but and there are less than 5 local cases in our hospital due to COVID-19. One of these is connected to the Severn Court outbreak. This map that we'll show you now shows our cumulative case incidence rate. We are now at 457 cases per 100,000. Our weekly rate, though, has grown quite considerably from 16 cases last week to 40 cases per 100,000. I'll just remind you that 40 cases per 100,000 is the threshold for moving into the red zone. We are sharing our data with the Office of the Chief Medical Officer of Health, and we are expecting a decision that might see Peterborough move into a more restrictive zone to align better with the amount of COVID transmission that appears to be occurring here now. So that's the end of the slides. At this point, I would like to introduce the president of Fleming College, Maureen Adamson, to provide us with a few more details. So over to you, Dr. Adamson.
Thank you, Dr. Salvatierra, and thank you, everyone. I just want to say, like we all feel the same, Dr. Salvatierra, you are doing yeoman service to our community. Thank you. We want to continue to collaborate with you. If there's anything we can do on the police investigation, Fleming will be there by your side. I think many of you have seen the position of Fleming that was made yesterday by way of a letter and news release. And right now we are, again, trying to collaborate with all of the investigation to manage the spread, and we are organizing internally to establish our own tribunal for when we do our review of the individual student by student cases. So that's my update.
Thank you so much, Maureen, and thank you as well for all of Fleming's much appreciated efforts to help us contain this outbreak. While this outbreak has indeed been a priority concern for us, the other priority is rolling out the COVID-19 vaccine. The good news is that vaccinations are accelerating. On this slide, you can see in green the groups that are included in phase 1 of our rollout. Yesterday, we assisted Curve Lake First Nation in holding their clinic, where the first dose was administered to about 300 citizens. Curve Lake is on schedule to complete all of their immunization by the middle of next week. Clinics are planned for Hiawatha First Nation for March 13th and 14th. And in partnership with local Indigenous organizations, we will be providing clinics for our urban Indigenous population during the week of March 15th. Working with our Indigenous partners has been a very positive experience, and we are so appreciative of their leadership in planning these clinics. The clinic at PRHC is making excellent progress, vaccinating the highest priority healthcare workers. We understand that all 5,000 of them have received an invitation to book their appointments. We will soon be moving into the next group of very high priority healthcare workers, which includes our community primary care providers, our dentists, and others. Second doses will be completed in all local long-term care homes by March 9th, and first dose vaccinations continue in retirement homes as we speak. We have secured enough vaccine to offer first doses to our local population of adults who are 80 years of age or older. And you can see on the chart that there are approximately 7,200 seniors living independently in our area. They will be able to start booking their for local clinics in March as soon as the provincial COVAX online booking system opens on March 15th. We are currently piloting that system with the province. Clinics will be offered in both the city and the county, and staff from the city and the county will be assisting us with our call center to support appointment bookings over the phone. We are extremely grateful to all our municipal partners for stepping up to assist us without hesitation in this mass immunization campaign. In the meantime, I encourage anyone who is over 80 and who is immunocompromised or who has experienced an allergic reaction to past vaccines to contact their healthcare provider for a consultation. If you don't have a healthcare provider, the virtual care clinic can assist you. I would also like to let our over 80 residents know that now is also the time to identify who can assist you in booking the appointment and transporting you to the clinics. Details on how to book, as well as our clinic locations, will be announced very soon. You will need to use your health card, your healthcare number, to assess the system, and you will be eligible to be immunized if you were born anytime in or before the year 1941. It doesn't matter whether you were a March baby or a December baby, it will be the year and not the date of your birth that will be your ticket into the booking system. Thank you.
Thank you very much, Dr. Salvatierra. Okay, we are fortunate to have with us today MP Miriam Monsef to join us, and I would like to invite you, MP Monsef, to share some remarks if you've got some comments today. Maybe we're waiting on some, oh, I think I see some technical things being worked out.
Hello, everybody. Bonjour, Anin. Salam alaikum. Can you hear me okay?
Yes, we can hear you just fine. Go ahead.
Perfect. Thank you so much for convening us, and Dr. Salvatierra, Chair Mitchell, and the entire team at Public Health. I know that on top of vaccine rollout and everything else public health does, This past week has been a very, very busy one for you, and we appreciate you. I'd like to focus my remarks on public health guidelines, on vaccines, and put forward an invitation. This week has shown us the importance of following public health guidelines and just how quickly this virus can spread when guidelines are ignored. We have all sacrificed so much this past year in order to keep ourselves safe, to keep our loved ones safe, and our community safe. Some have made greater sacrifices than others, and we can't stop now. We can't let all those sacrifices go to waste when we are so close to the end. I know events like St. Patrick's Day, Easter, April in general, Nowruz, and the spring solstice are upon us, but now more than ever, we need to ensure that we follow the very smart public health guidelines and the advice that Dr. Salvatierra and others at Public Health provide us with. It will save lives. And there is good news. Everyone's aware that AstraZeneca was approved by Health Canada. The first shipment arrived yesterday. In addition to the 20 million doses we have already secured, we're recently securing access to an additional 2 million from the Serum Institute of India and 1.9 million through COVAX. These 3.9 million doses will arrive before the end of June. Delivery timelines for the other 20 million are still being finalized. Our delivery timelines will continue to ramp up. This week, we're receiving our largest delivery to date of vaccines, 944,600 doses. This includes 500,000 AstraZeneca vaccines and 444,600 Pfizer vaccines. We're scheduled to receive another 444,600 doses of Pfizer each week for the next 4 weeks. And we're also scheduling to be receiving 1.3 million doses of Moderna over the next 4 weeks. Including this week, this puts Canada on schedule to receive 4 million doses between now and the 4th of April, which is 110,000 doses a day Canada-wide. These numbers will only increase, and we see that ramp up in our own community. As the Prime Minister said yesterday, these timelines have the possibility to accelerate even further if more vaccines are approved, and as we finalize delivery schedules of the AstraZeneca vaccine. I want to thank everybody who's working hard to get those needles into arms in our own community. I want to thank particularly Public Health and the community at Curve Lake First Nation and the leadership there. And special thanks to every individual who's having very difficult but important conversations with their loved ones about why the vaccine is important. Lastly, as we approach Monday, Women's Day, we also approach the 1-year anniversary of COVID. Many lives have been changed, many have been lost, and many women are on the front lines of the fight against COVID. This Women's Day, we salute them. We recognize those who've been hardest hit. In our own community, there are many women, including those on this call, who are leading with strength and integrity and taking care of the rest of us. From 1:30 till 3:30 this Friday, we will convene on Zoom just a few of these women so that the community can better understand their stories and their leadership styles. I invite you to join us.
Thank you very much, Miriam. Great to have those updates. And I will now turn it over to our media guests. And I do have a list of about 7 or so who have signed in today, which is great. So now is the opportunity to ask some questions. Let's start with Taylor Clydesdale from Peterborough this week. Go ahead, Taylor.
Oh, excellent. Thank you. I do have a number of questions for Dr. Salvatierra, but I think I'm just going to start with a quick clarification question for Maureen Adamson, if she's still on the call. Maureen, I'm just wondering if you might be able to give more details because you on this tribunal that you had mentioned. Just wondering if you know what that entails, and what kinds of results could come out of that tribunal, and if you even know who is going to be tribuned.
So under our student rights and responsibility policy, we would set up what they're calling a tribunal, where we would have obviously representation from our student association, faculty, and an administrator. And we would go through, once we can determine who the individuals are, we would certainly look at each individual circumstance and determine what might be an appropriate action. And again, it could be anything along the continuum of written reprimand, suspension, behavioral contract, all the way through to the ultimate, which would be expelling the student. So we have not identified who the specific individuals will be, but we are just organizing ourselves currently.
Okay. So you haven't specified, so it's still ongoing as to the investigation on who this tribunal might be for then?
It will be internal people at Fleming, and probably certainly someone from the student association, a faculty, and another individual. But currently our VP of academic experience, who is on the line, as well as VP of student services, are working on setting that up.
I know the health unit, police, and the college are all kind of involved in this. Does the college have any plans to release the names of those who are subject to these tribunals?
No, the college will remain confidential. We will not be disclosing any names of students or programs that they are in.
Okay, perfect. I think that's all for you, Maureen. Thank you. Going to Dr. Salvatierra. You had said that there are variants that are in the community, or presumed variants that are in the community, that aren't connected to the Severn Court outbreak, correct? How did they get in the community?
Well, as you know, we had evidence of variants even before the outbreak. And so obviously they've arrived and we are finding more evidence that they are spreading in the community.
Okay. And do we have evidence that there is spread in the community from the Severn Court outbreak? So we're seeing people who aren't directly connected to that outbreak, so who aren't Fleming College students or who aren't residents at Severn Court, who were infected from that outbreak?
We have also students from Trent as well, and we are seeing roommates, so high-risk contacts of those cases also becoming infected.
Okay. And I did just ask Maureen about this tribunal, but I do want to check in with you on potential fines or charges for party organizers. Just wondering if there's any update on that.
Yes, we have warned an individual who has breached our Section 22 order, who is at Severn Court. So they have been warned, and I believe that we will be issuing a news release very shortly about our recent enforcement efforts.
Okay. And the Section 22 order, that's the order to not leave the residence unless for food or medication purposes?
Well, there are actually two groups in that order, Taylor. One group are the people who are cases or are high-risk contacts. They cannot leave their rooms, right? They're in self-isolation. And then the remainder of the building residents are under a stay-at-home order, and they can only leave to get necessities such as groceries or prescription drugs.
So this individual falls into one of these two groups,
yes,
is one part of that order. Okay. Just in regards to moving into the orange zone potentially, do you have a prediction as to when we might be headed there if that decision is pending?
Well, I think you're being optimistic, and that's nice to see that we might only go as far as orange. I'm not sure that that's where we'll end. As I said earlier, our current weekly incidence rate is already at 40 per 100,000, which it does align with red. So we have been sharing our local data with the Office of the Chief Medical Officer of Health, and we do expect to see a change into a more restrictive zone. We understand that these are usually decisions that are made by Cabinet, and they're usually made Friday for the following Monday. And in addition, the Chief Medical Officer of Health does have his emergency brake authority, so he could actually implement something sooner and even more severe. So we don't know yet what to expect, but as I said, we are sharing our data so that the province is well advised of what's happening here locally.
Okay. I just had a couple of questions, and I'm sorry for taking up so much time today. In regards to the restrictions about restaurants that were announced. We're just seeing a couple of restaurants that are kind of pushing back against and saying that these rules are overly restrictive. They're overly punishing small local businesses in comparison to kind of big box stores that or bigger chains that have been able to remain open. Just wondering if you have any response to these restaurant owners that are complaining.
Sure. I mean, I feel for them. I mean, I know how difficult it's been for everyone to get through this pandemic intact. However, I have not placed new requirements on the restaurant sector. I'm not focusing on them any differently than any other of our businesses or retail settings. The letter of instruction that I issued provided clarification about the provincial regulation that states that every member of the public in a place of business or facility that is open to the public shall remain a physical distance of at least 2 meters from every other person except their caregiver or from members of the person's households. So this applies to all businesses and all patrons. So frankly, I'm having a little trouble understanding what exactly people don't get. First of all, every individual is mandated to stay at least 2 meters away from anyone who's not their caregiver or a household member. Secondly, we're also mandated to wear a mask when we are within 2 meters of anyone not in our household. Thirdly, we have evidence of fast and furious transmission of VOCs in our community. So now if I drop a table down next to you and I set it nicely, how does that really change anything? What I am requiring from everyone is consistency. So whether you are in a staff cafeteria or a restaurant or in a grocery store at the deli counter, the rules are the same. And there are no exceptions for people who are dining out. So this is not the time to party with others, whether it's in a bar or in a home or in a student residence like Severn Court.
All right, perfect. I think that's it for me. Thank you so much, Dr. Salvatierra.
You're welcome.
Okay, thank you, Taylor. Okay, let's hear from Matt Barker from the Peterborough Examiner. Go ahead, Matt.
Hi, Dr. Salvatierra.
Hello.
So today, I'm hearing from a few people that students involved in the Severn Court incident were doing placements. Now, is there any concerns about an outbreak at any of the places of any of the facilities, where placements were being done, I guess?
Yes, lots of concern. And for this reason, the college has suspended their placements. And we, of course, as we identify the specific details, we are working with those settings to ensure that there has not been any transmission.
All right. So one of those places that I'm hearing was PRHC. Now, what's being done to help prevent any spread? What kind of, I guess, things are you guys doing to prevent that?
Well, you'll have to speak. I would suggest you speak directly with PRHC, and they could tell you all of the actions they've taken. We've also worked with other settings. Of course, PRHC is not the only one. And sometimes it's a combination of efforts. Usually it is. It's not just one thing. It usually involves contact tracing, potentially testing, additional cleaning and disinfection as well. So again, I would think for the specifics, it's probably best to contact that particular setting.
All right. I have a question for Maureen Adamson if she's still on the line.
Yes, I'm here.
Hi, Maureen.
Hi.
So when it comes to students who have been in placement but have now tested positive, how often, before it was known, how often were students being tested in placements to, I guess, prevent a spread like this from happening?
I honestly don't know the answer to that question. I don't know if Vice President Poirier, you do know that?
So you're asking how often the students were being tested for COVID?
Right, inside their placements.
Right. So that would be based entirely on the protocol within those facilities. We have students at a great variety and number of placement sites. Most of them work in some of the sites that they're placed in, and so they were actually following the criteria as an employee as well. But we don't have a standalone screening for students. That would be part of the protocol of the facility that they were in. And as Dr. Salvatierra has indicated, we did immediately suspend all placement. And we are reevaluating that on a daily basis in terms of what is the safest thing and the best way to proceed. And we're having conversations with our community partners to ensure that we're all feeling confident about next steps. But they have been suspended for 2 weeks at this point until we make further decisions about that.
All right, thank you.
Is that everything, Matthew, or are you finished?
Yes, sorry, I am finished.
Okay, good stuff. All right, so I'll invite Paul Rellinger from Kawartha now. If you've got some questions, go right ahead.
I do, Brittany. Thank you so much. Dr. Salvatierra, on the possibility, which, if I'm hearing you right, remains strong, that will be moved to another level, is there any hope for any kind of mitigating circumstances that would prevent that from happening despite our numbers? Or is it a fait accompli, this is going to happen?
It really, the zones are based on data, Paul, and so it really is it depends on what's happening here. If we were to see a reduction in the number of daily cases that we're getting, that certainly would keep us either in yellow or potentially in orange. But I must say it's not going in that direction right now.
Okay, and fair enough. And when, will you have communication with the province on this? Is there a set time, like tomorrow, you'll be discussing it, or today?
Well, I've already had conversations earlier in the week with the Chief Medical Officer of Health, and I did communicate yesterday, giving him an update on our data. Mm-hmm. So I really don't know when I might expect to connect again over the situation.
Okay, thank you. And regarding the warned student that you were mentioning earlier, you mentioned the two groups that Section 22 applies to. Which group was that student in? Was it one of the have to stay in your room students, or one of the don't go out unless it's necessary students?
We'll need to ask Julie Ingram that question. I don't know if Julie's on the call right now. If she is, Julie, I'll ask you to respond. If not, we'll get back to you, Paul.
Okay, fair enough. Yep, thank you. Now, on the enforcement, you did say a release is coming shortly, updating that situation. But in advance of that release, can I just ask, it's been almost 2 weeks since the party, and I'm just trying to get a sense of what the big challenge has been in terms of identifying an individual or individuals. There's a question of a lot of people being there and a lot of fingers pointing in different directions, or is it really just related to the size and the number of possible suspects, I guess?
No, I think you nailed it, that we're getting different accounts and different stories. Sometimes they don't match. And so for this reason, we did ask the police to investigate. And I believe we do have the police on this call today, right, Brittany?
Yes, Chief Gilbert is joining us as well.
So I'm wondering if Chief Gilbert maybe could help answer that question.
If he could.
Thanks, Doctor. We also have Inspector John Lyons on the call, and Inspector Lyons is going to take carriage of managing the investigative side for the police service. So there's going to be an awful lot of work that needs to be done. Obviously, there's contact tracing that's being done by public health, and we do need to liaise with them and have a good discussion as to who all of the involved parties are. I can indicate that there was one night that we did receive a radio call to that residence for a noisy party. However, when the officers attended there a few minutes later, there was no answer at the door and all was quiet. So when it comes to the party situation taking place, we had very little involvement that night, other than that one call for service that I've been made aware of. Although we're doing a lot of pointing at Fleming and Trent students, this is an off-site residence that is not specifically affiliated with Fleming or with Trent. And it's important to remember that both Fleming and Trent University have been very strict in their adherence to public health guidelines for students attending those institutions. And, I have to be very complimentary of both Fleming and Trent for all of the measures that they've put in place to keep students safe with off-site learning, et cetera. And even when students are attending both of those institutions since the COVID outbreak, they've been very strict in their requirements for students to keep them safe and keep the community safe. So we are looking at some members of our community that are affiliated with those two learning institutions that, while off-site, didn't follow the best practices of public health and certainly didn't follow, as we've heard, the directions that both the college and the university had provided to all of their students on how they should behave and how they were to conduct themselves to keep the community safe. So I can turn it over to Inspector Lyons and he can flesh out a little bit more of the details, but I do want to commend President Adamson and all her staff, as well as Trent University, for everything that they've done. This is an isolated incident, unfortunately, that has big repercussions in the community, but both of those institutions have done great work educating students and keeping the community safe with all the measures they've put in place. So the brunt of any community anger should not be directed at the institutions of Fleming and Trent. We're dealing with some isolated members of the community that didn't follow best practice. So Inspector Lyons, I'll turn it over to you.
Thank you, Chief.
Yeah, thank you, Chief. Just to touch on that, Paul, as far as the investigation goes, so obviously you've kind of alluded to the fact that we are dealing with, to some extent at this point, an unknown number. We're trying to isolate and identify any and all of those that were involved. That does take some time. Also, we have people that are in quarantine, so it makes it very difficult to make contact with individuals that are involved. There is also potentially been some movement of people, which makes it difficult to track people down and get any kind of involvement from them. Any investigation has to be done from the ground up, and we have to make sure that we're doing it appropriately, and that we're not jumping the queue, that we're actually taking our time, because I think Dr. Salvaterra has alluded to the fact that there's a lot of misinformation and information that has been provided to try and distract any potential investigations. So we have to work through all of those pieces as well, to try and actually find out who's involved. We can't just charge people because it's time sensitive in some respects, but we certainly are going to look at all avenues in the investigation, but the investigation has to be completed. We definitely have to find out who is involved, to what extent, and then at that point, the investigators will be able to take that information and form the best scenario from it, and then we will determine who is responsible and who potentially may be charged out of the situation.
Thank you. And just to clarify, the maximum amount of any ticket is $750. Is that correct?
It works out to be $880 with the victim surcharge, but yes, it's $750 plus the victim surcharge.
Okay, and in terms of a person or people potentially being ticketed, are we looking at just organizers, or are people who actually simply attended liable to be ticketed?
Well, therein lies the part of the investigation of determining to what extent people are involved, to what knowledge they had, how long they were there, if it was happening and they were there knowingly. I mean, it could have been in an area that those partaking were not necessarily attending. It could have been in somebody's residence that they share with one of those individuals. So we really need to work through those details before we can actually start to identify those that potentially could be charged.
Okay, thanks so much, John. You've really cleared it up a lot. I appreciate it.
You're welcome.
Sorry, if I could jump in as well, Paul. The other issue now is we're beyond 7 days of the incident. So the ability for somebody to have an out-of-court settlement for that $880 fine is no longer there under the Provincial Offences Act. We'd be looking at Part 3 summonses with a court date because we're beyond the 7 days. So anybody who does find themselves facing a charge will have to go for a court appearance. Now, obviously, they could be given a fine in court, they could have it adjourned to another date, but we're beyond the ability for somebody to simply get a ticket and pay it. They'll be required, if they are issued a ticket, to go to court under Part 3 of the Provincial Offences Act.
Okay, so just to clarify, it doesn't go from the date of the alleged offense, it goes from the date you receive the...
It's the date of the alleged offense, so we're beyond
Right,
the 7
okay.
days from the date of the offense. We could very well be, beyond 7 days of the date of the offense, and they won't be getting an out-of-court settlement because it now is required under Part 3 of the Provincial Offences Act. So.
Okay, perfect. Thanks for clarifying that. That's good to know. I thank you both very much. And if I could, Brittany, just one clarification for Dr. Salvaterra, and then I'm done. In terms of the variant cases, Dr. Salvaterra, can you just point out the difference between confirmed variant case and presumed, just so I can kind of get a handle on that?
Yes, I'll try. So right now, the province, so Public Health Ontario Lab is screening all positive cases for a mutation that is linked to being a variant. So it's a certain mutation, and they're this assay usually takes a day or two for a result, and we are notified. We get an alert that the case the specimen has screened positive for a variant. And that's what we're calling a presumed variant. When they've gone back and evaluated how well the assay works, it's almost 100% sensitive and specific. So when you screen positive, even though we're calling it a presumed, it more than likely is going to turn out to be one of the variants of concern. The actual sequencing of the viral genome takes 7 to 14 days. And that's when we get the result to say that this particular case was caused by B117 or B135. So that's when we call it confirmed, when we actually have the sequencing result.
Perfect. Thank you. I kind of knew what it was, but I wanted to make sure I got it right. I apologize for taking so much time. Thank you so much.
Okay, thank you very much, Paul. No, there's lots to cover these days. So let's hear from Matt Latour of our radio friends. Please go ahead, Matt.
I've got a couple questions for Dr. Salvatierra and then one for Chief Gilbert at the end. My first question, Doctor, I've seen some posting on social media about people sharing rides to go to Brampton from Peterborough and vice versa. Is this, I assume this is something that Peterborough Public Health discourages, but is there any way that you can maybe enforce against this?
Well, we have done some communication on that, Matt. I believe I saw some Facebook messaging that was done yesterday advising students about not to ride share and the dangers of ride sharing. So I know we are working on it, and I believe we're doing so with our partners as well, so that students understand that this is risky and that we are asking them not to participate in that.
I know, obviously, you mentioned earlier this week that when you're out dining, restaurants should be keeping track of whether or not people are in the same household. Mm-hmm. How can something like this kind of be tracked at a place like Lansdowne Place in the food court, where anyone can walk and just sit down with somebody else without having to fill out a form?
That's a good question, Matt, and I think that's one that we can direct to Julie and have her get back to you. Food courts are separate from other food premises, and there's different instructions for them. So we certainly can get back to you.
Does Peterborough Public Health know what the state of the ventilation at Severn Court student residence is like, and whether or not that's something that's factoring into additional cases?
Again, I'll have to ask Julie whether this has come up, and we can get back to you on the ventilation at Severn Court.
Perfect. And for Chief Gilbert or Inspector Lyons, whoever can speak to this better, I guess. You mentioned that there had been one call to police on February 20th about a party. Has there been any previous calls before the 20th to Severn Court?
Not that I've been made aware of, Matt.
Yeah, I mean, it
That's
would not be.
We could certainly have a look at as well and go back further in our database to see, but not that I've been made aware of unless Inspector Lyons does.
Yeah, nothing that, again, I'm aware of either directly related to parties happening, especially during this particular time frame. I can tell you historically we've had to attend there in the past for calls, but if we're talking in the last, say, 24 months, I definitely have to look at that.
That's it for me. Thank you.
You're welcome.
Oh, okay, great. Thank you very much, Matt. Okay, I see Reg Watson has some questions for us. So, Reg, if you'd like to go ahead.
Just a quick question. Historically, has Peterborough been in either the orange or the red zone before, apart from the province-wide lockdowns?
Yes, we have. If you recall back in the second wave, we did make our way through the colors. I'm trying to remember whether we made it to red or whether we got as far as orange before the stay-at-home and the shutdown. We had the stay-at-home order that came into effect Boxing Day. And then, of course, the shutdown where we all went back into gray. So I'm not sure if we've been in red before. We'll have to check on that one and get back to you as well.
Thank you. I'd appreciate that.
I've flagged that question, so I can follow up with Reg after.
Thanks, Brittany.
Okay, thanks. Okay, so Jessica Nisnik from Global, if you've got some questions for Dr. Salvatierra, please go ahead.
Thank you, Brittany. Dr. Salvatierra, I don't know if you're going to know this or not, but for registering, you mentioned for the vaccine that people need to have their health card. Would it matter if their health card is expired? Because I just did a Ministry of Health story, and they're still giving us a leeway on when we have to renew, and they're saying they're asking healthcare providers to accept them, but healthcare providers can refuse. So do you know where we stand on that?
So I'm not sure whether if you type in the old number, whether you can still register. We'll have to find that out. But I also know that there are workarounds, so that even for people who don't have healthcare numbers, there is a way to have them registered and identified in the system. So whether they can do that online or whether they're going to need some telephone support, I'm not sure.
Thank you. And lastly, maybe I saw that Peterborough Public Health issued earlier, I don't know if it was this week or last week, a reminder not to call Peterborough Public Health, that you will let us know when it's open. Do you want to just reiterate that maybe?
We've launched our public campaign, our communications. We will be working with a variety of partners, the county, the city. We'll be using different media in order to reach all of the 80 and over residents in Peterborough, the county and the city. So we do ask people not to call us right now. The launch is March 15th. And that's what we're currently working towards. And we will make sure they have the information they need so that once the booking system does open up, that they will be able to access it and make their appointment. I think the good news, Jessica, is that we have enough vaccine. So people don't need to be anxious, and feel that they have to call us right away. We have enough vaccine for all of our 80 plus population. The province has guaranteed to me that we will, that week of March 15th, that they will be sending us enough vaccine. So people can take their time, they can be calm, get the help they need, and get an appointment. There will be enough appointments for them.
Thank you. That was it for me. Thank you very much, Dr. Salvatierra and Brittany.
Okay, thanks so much, Jessica. Yes, and as soon as we get the number that residents can call on the provincial COVAX booking system, we will be sharing that far and wide. Okay, so I think it's our last journalist today. We have Mark Junta from Global. Do you have any questions for our speakers today, Mark?
Yes, I do. Just wondering, given that now we're a few days in and we're seeing the cases increase, and we know this is a big outbreak, but do we have any grasp on just the magnitude of it or where it's going to head?
Well, I think that's what the testing is meant to do, Mark, and that's why we are working with the paramedics to go into the buildings at Severn Court and do door-to-door testing. So that's going to give us an indication of how much spread we had in the residents themselves. We're looking at other sources of data. We've been working with Trent on some exciting analysis of wastewater. And so we had, for example, some early data to show growing activity both in the city and related to the campus. So once that data is available to share with the public, we will be doing that, and we'll be briefing the media on that. But we're also looking very closely at wastewater as another indicator of whether we've got more transmission occurring in our community.
Yeah, for sure. For the actual outbreak itself, could you just break down the cases again, the number of cases, VOCs, and then maybe Fleming to Trent students positives?
So we have 44 total cases, and of those, 30 have screened positive as a presumed VOC. We have 40 high-risk cases in the buildings at Severn Court. And we have over 60 high-risk contacts that have been identified that are outside of Severn Court. So they're somewhere else. Most of them are in the community. Some have gone home, but we are certainly keeping in contact with all of them. Has that answered your question?
Yeah, and then just on the warning for the one student, couple questions on that. Just why a warning and not a fine, and what would the fine amount be if a fine was levied?
So I think for that one, we're going to need to get Julie Ingram to give you that answer, because I don't have that granularity, and Julie would be able to answer that question, I believe.
Actually, I might be able to help with that one, as Julie and I were in touch with regarding some of the details, and she did explain that an investigation was conducted, but not enough evidence was available to actually lay a charge, so that's why a formal warning was issued instead. And I understand, as Chief Gilbert mentioned earlier, that the amount for the charge is $880 when you tack on the victim surcharge.
Thanks, Brittany.
Okay, so it's the same as just a violation under the Reopening Act as is. Just wondering about the surveillance testing. Has that started? And if not, when?
With the paramedics, you mean, the door-to-door?
Yeah, I guess it has started, but just maybe tell me how that's going so far.
We'd have to get our manager, Patty Fitzgerald, to respond to that question mark, because she's the contact with the Peterborough paramedics. So we can certainly get back to you on that one.
For sure. And just actually my last question would probably be more directed towards the police, but that would just be that we're now outside of that 7-day window to settle out of court, but would going to court, could that fine amount change and be increased from $880 to something else if the person is found guilty?
Hey, Mark, John Lyons here. Yeah, there is a potential for that to occur, especially on a Part 3 summons. That's entirely up to the Justice of the Peace for them to determine based on their finding.
Okay, thank you all.
You're welcome.
Okay, thank you. So I think we have had a chance to hear from all of our media partners. So thank you so much. Appreciate our representatives from Fleming College joining us today, and the police. And thank you so much, Miriam, for also sharing the federal updates. So with that, I think we are ready to wrap up. We will see you here again next Thursday at 12 noon, barring any other urgent media briefing we need to host. But with that, thank you so much for your time today. And I got note of all the questions, so I will be following up with our media partners on that. Thanks all.
Thank you, Brittany.
Bye.
Thanks. Bye.